Hey, it's Mickey with Motion Restoration. So in today's video, I'm going to be showing you how to massage your child who has Osgood-Schlatters. So my son has been diagnosed with it a few days ago, but he's been complaining of the pain for the last couple of weeks. So this is the massage that I've been using to help him out at home. So first thing you're going to do is grab your lotion, something with good glidability, or your coconut oil, and let's get started. So we have our child lying face up, and we are going to expose the leg we're working on. So he was diagnosed in his right leg. So I have my sheets going to be going underneath the knee, tucked up, and then the top of it is going to be tucked underneath his hip. So he is nice and secure within the sheets, and we're going to be exposing the quad, so the whole front portion of the leg, as well as down into the shins. So the area that is affected is just below the patella, right inside of here, but we need to relax the quad muscles because the quad muscles, they come up, over, and then insert into down in here. So grab onto your lotion, warm it up in your hands. I like to start at the bottom here, so we're going to go up the shins and then into the quads, all the way up. So this is just a nice firm pressure. We're not getting in too deep quite yet. So just warming up the area. All right, and then what we're going to do is just taking the heel of our hand, starting just on the inside of the leg here, and we're just going to be pushing up the muscle nice and slow into near the groin area, and then just working our way across into the middle, or the muscle that is very much so affected. So I want you to watch your child, watch their pain tolerance with this. If you're noticing wincing or crying, they're going a little too deep. So you can back off a little bit. So just relaxing the quad muscles. This is up the IT band. This can be quite tender, especially if your child is active. And then what we're going to do is you're going to take the heels of your hands and you're going to go down and pull up. So you're in a scooping motion, pulling up on the muscles. So scooping, and we're going to work our way down the quad. And then push it all back up. And then again, we want to focus on the quad muscle that's right in the middle here. So we're going to do a few more passes with the heel of our hand. Nice and slow, because sometimes those muscles can kind of pop up and go back and forth, and it just makes it uncomfortable. So along the pain tolerance of your child, going up the quad. So the quad is a big muscle that becomes very tight when it comes to having Osgood-Schlatters. So you really want to relax. So by going fast and going through these movements quickly, you actually start to stimulate the muscle, which can cause it to contract a little more. So by doing slow movements, you're helping to actually relax the muscle more. So we're still going up the quad, relaxing the muscles. Then we want to go into the top portion of the knee. So we're just going to use our thumbs and we're just going along the bone here, which is called the patella. So we're just going along the top of the patella, just tracing our thumbs one after the other. So then for this next portion, I find when I like to start, I always start with the knee partially bent just for comfort wise. But for this next part, we're actually going to take the pillow out from underneath the knees. So we're going to have the leg be nice and extended for this portion because I really want to get in to the spot underneath the patella. And sometimes when our leg is bent, you can't really move the patella, but when it's nice and extended, you have a little bit more mobility with it. So what we're going to do is, again, grabbing that lotion, and we're going to go over top of the patella. So I'm reinforcing the skin on the top, and all I'm doing is just pulling down nice and gently over top of the patella, just going underneath. So we're going to do a few passes. Little one is breathing quite heavily, so it's a little bit of pain in here. Again, going nice and slow. I'll just do a few more passes for that. There we go. Okay, so next up, we're going to go on to the sides of the patella bone here. So we have the kneecap, so it's nice free floating bone. So if you want to kind of push it towards you, you can see the edge. That's where you're going to start. So you're just going to take the pads of your thumb and you're going to friction up and down along the border of that patella. So we're going all the way on the inside. And then we're going to trace it to underneath. So this is where we have a lot of pain in here. So keep on frictioning, watch child, make sure you encourage breathing through your nose, out your mouth. We're still going to be frictioning all the way along underneath. And then we're going to be going on to the inside there as well. So all the way along there. And then the area that really is going to be where you want to do your focus. So again, we have that free floating bone. You can feel it moving around. Just below that, I want you to feel the top here. So we have our tibia bone at the very top. It kind of comes into a ledge. That's the insertion point that we are focusing on with this knee. So within your child's pain tolerance, you're going to find that tuberosity. You're going to go just above it, below the patella bone, and we're going to friction. We're going to go back and forth, and we're going to go up and down, keeping an eye on the child's pain tolerance. So we're going to be frictioning nice and gently in here. So the back and forth, and then the up and down. Just like that. Then you're also going to go directly on top of that top of the bone. So again, we went just where there's a nice soft space. I want you to go right on top of that bone, and you're just going to gently friction along that bone, just like so. Now, if your child has quite a bit of swelling in this area, what I want you to do, right now his swelling has gone down. We've been doing a lot of icing. So you're just going to do some light movements over top. So I'm taking feather light. It is the weight of a sheet. And you're just going to go over top of the area of inflammation to push that inflammation out of the way. So nice light movements if they're still noticing quite a bit of inflammation there. Up and over. There we go. Then we're going to go into the shins. So for that, all you're going to do is, this is just a nice relaxing. So you're just going to go along the bone, find that nice soft fleshy area, your tibialis anterior, and we're just going to trace along that. Do a few passes of that. There we go. And then when you've done that, we're going to do the flushing towards everything, goes towards the heart. Everything towards the heart. So that is a very quick massage that I showed you. On average, you're looking at between 10 to 15 minutes for massaging your child. You can do this for up to 2 times a day. It is okay to do. The main goal is to decrease the tension that is in the quad muscle because it feels very tight, as well as decrease the swelling that is in the tendon down there. So perform this for your child. It does help them out. Another big thing to mention is going to be hydrotherapy. So by using cool or ice, one thing that we found works amazing is get your child in the river. So we live in Alberta, it's very cold. We have glacier-fed rivers here, so it was very, very cold. So getting them in that will help because it is a non-weight bearing. It also will help with decreasing that inflammation, and then you get all the electricity from earth, which feels amazing. So I wish you the best of luck with your child who has Osgood-Schlatters. If it is within your scope of practice, you can always do ice massage for this as well. So if you have any questions or comments, please feel free to leave it down below, and don't forget to like and subscribe, and we'll see you in the next video.